Welcome to
back
the podcast.
to the podcast.
Welcome to the Visceral Voice Podcast. Welcome to the Visceral Voice Podcast. I'm your host, Christine Schneider. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, a movement specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everybody. Welcome back to the podcast. Today, I am so excited to be talking with Dr. Erica Kesselman. She is a passionate mother of two, an obstetrician and gynecologist who sees every moment as an opportunity to learn more about people and what makes them tick. Dr. Kesselman has been a teacher, a Pilates personal trainer, a child advocate, and a radio personality. She has taken to social media, becoming an OB-GYN influencer, to challenge her biggest competitor, Dr. Google, of course. Oh my gosh, wait, but I have to get this right because it's so cute. So she has taken social media, becoming an OB-GYN influencer.
Actually, I usually just call it an OB-GYN influencer.
Yes, OB-GYN influencer to challenge her. Oh my gosh, I just love it so much. So I was like, oh wait, I think I got that wrong, and I just wanted to say it. But regardless, I'm so thrilled to have you here, Erica. Welcome to the podcast.
Thank you so much. I'm so excited to be a part of this. I've been listening to the podcast for a while, and I'm learning so much every time I listen. So I'm really excited to be here. I do apologize for the nasally tone. I am traveling and at the tail end of a cold, so I apologize. This is not my normal voice, it just feels very strange being on a show about larynx and nasal passages but we talk about how the body is all connected, and this is the immune system working really hard.
Yeah, that's right. And I mean, I hope you feel better soon, especially I know being on a work vacation. So I hope you feel better. But thank you for being here, even at the tail end of a cold and on a work vacation. So thrilled to have you here. I would love to start with kind of your journey into what led you to become an OB-GYN and to the work that you do now? And then what led you to start to want to become more of an OB-GYN influencer on social media? Because I think that's really exciting and really important.
So it's kind of an interesting beginning. I decided early on that I really wanted nothing to do with any of my girl parts. I didn't want to have my period. My mother actually brought me to the pediatrician when I was 15 and a half to see if I could will it away because I hadn't gotten it yet. And the pediatrician said no. She said, well, she's very willful. If anybody could do it, she probably could. And medical school was a natural progression for me. It was more of a calling than anything else. I just was so intrigued by how the body works. How can we live in this meat suit and not know how it ticks, how it works? So I was a bio major who loved to read. My undergraduate degree was biology and English. I double degreed or majored and minored, and then took a couple of years off to make sure that medical school was really what I wanted to do. And when I got there, I was shocked to find that the place where I felt that I fit the most
Mm,
was in the OB-GYN setting. Maybe some of my ADHD, maybe that no 2 days are ever the same. I love the idea that I can treat somebody medically as well as surgically, and then you throw the adrenaline rush of deliveries and babies into the mix, and it becomes kind of magical. So
mm,
it's just where learning really became very easy. So I went from this 18-year-old that couldn't say the word gynecologist, it was the G doctor, sex was doing the nasty. I was going to be an 85-year-old virgin living in Manhattan, wearing big red hats and going to museums on the free days. Like that's really how I saw myself for a long time. And then going into this world that just spoke to me. And then I asked my OB-GYN, who I adored. She made my first visit painless and easy and comfortable and atraumatic. And I asked
mm,
her what drew her to OB-GYN. And her answer made me even happier that she was my doctor. She said that OB-GYN is really a celebration of women through all
mm,
of their life cycles. You help girls through puberty, you help women through relationships, STDs, new partners, marriages, divorces, and then bringing children into the world if that's what they want, or not bringing them into the world if that's not what they want, or if they can't, helping them navigate that. And then aging and menopause and all of the things that go along with that. You are with people, women, or people who have been assigned female at birth through their entire life cycle. And that's a pretty magical thing and a huge privilege. So I've been doing it for about 25 years. And I don't think I've gotten to the point where I've delivered any babies that I've delivered. But I've also been able to move my career around a little bit. For a while, when my kids were teenagers, I did just GYN. So I was home in the afternoons for them and I didn't do obstetrics. I went back into obstetrics, said nobody ever, and because I kind of missed it. And so I do that as well. And then I found that in my process, I was saying similar things over and over and over again. And the medical world has gotten to a point where anybody with a phone is an expert. And
mm.
I got tired of debating with people based on what they read in Google. And so I decided if you can't beat them, join them. And so I launched the Girlfriends Gyno on TikTok and the Meta platforms to just try and give science-based medical information in snack-sized pieces.
Yeah. Yeah. So great. And I'm so thrilled that you are doing that. And as we kind of talked about a little bit before we started recording, of just the many things. And I mean, you had just mentioned how you were saying the same things over and over and over again, but also just the many things that either we don't know about, we don't think about, or we're too kind of self-conscious to talk about, and we don't know who to reach out to for some of this information. And so I'm so happy to have you on the podcast, and also happy that hopefully the followers will go on and continue to watch your various platforms of the Girlfriends Gyno, because you're covering topics that are really important topics for us to discuss in kind of more open discussion. And but it's very rare to have some of it be in open forum discussion. So I'm really excited, and I hope that everyone will check that out. I
It blows my mind. And I said this recently in a post. I had my first post go viral. And it was really an interesting thing that I say all the time because I also teach sex education to middle schoolers and high schoolers. And the thing that I ask all the time in people that are assigned female at birth in an area the size of the palm of my hand, you're supposed to pee when you're supposed to pee, not pee when you're not supposed to pee, poop when you're supposed to poop, not poop when you're not supposed to poop, have sex, have babies, but don't look at it, don't touch it, don't enjoy it, don't know anything about it, never talk about it. And it becomes this area that is so powerful and that power gets taken away. And so I just asked the question to fifth, sixth, seventh graders, why do you think that is? Why, when three major organ systems terminate in an area that's maybe 4 or 5 inches in its maximum dimension, why? We talk about our nose and our mouth. People pick
Mm,
their noses, yet they're not supposed to put their own fingers inside themselves. Like, I would never let somebody pick my nose if I didn't know how far in to go and what it would feel like. So why would
mhm,
I let somebody else put something into me if I didn't know what it was going to feel like?
mm,
So it's really the question that I ask is why can't we talk about it? And why, when we're teaching anatomy, I mean, I can't even use, I don't know if I'm allowed to say the word vagina um, on your podcast, but I can't use it on Instagram or Facebook.
mm,
That blows my mind. I got shadow banned for using the word, which is just an anatomical term like knee,
mhm.
ankle, ear, nose, mouth.
Actually, a lot of people, a lot of speech therapists and laryngologists had things wiped down because they had images of the larynx, and somehow the interweb thought that it was a vagina and took it down.
I am not surprised, but it blows my mind. But I
Hmm.
think you had a great show on your podcast talking about how the laryngeal folds and the vaginal mucosa are so similar. And
Hmm.
it's amazing to me. Like, that is very cool because the voice does change at different times in our cycle and at different times in our life. We've known that since Bobby Brady. It happens in both genders.
Hmm. Yeah, definitely. And I want to talk more about hormones. I would love to start, if it's okay with you, to talk about IV. I'm going to jump right in and talk about some
Absolutely.
IVF treatment and how that systemically kind of influences or impacts the body. And then I kind of want to bring it into why I want this discussion.
Okay. I mean, I'm not a reproductive endocrinologist, so my knowledge may not be as cutting edge, but I pretty much know the basics. So
That's great.
let's see how we go.
Yeah, that's great. So what are some changes that kind of happen systemically overall when someone is going through something like IVF?
So, to talk about IVF, I'd like to backtrack just for a minute and just talk about the menstrual cycle in general, just to
Great.
have a brief overview of what we're altering. We need to know what it is. So, the menstrual cycle is a biphasic cycle that starts around a few years after the pubertal process begins. In the first half of it, it is very estrogen predominant, where the brain is contacting the ovaries. It's saying, make lots of follicles. The ovaries make lots of follicles. The follicles produce estrogen and progesterone. That causes the lining of the uterus to thicken, changes the cervical mucus to make it a little bit more penetrable or gooier, so that sperm can pass through more easily. And then ovulation happens. There's a change in temperature. There's also a change in the mucus. And the hormone levels drop and then they spike. That's why sometimes people get a little bit of spotting mid-cycle. And then the
Mm,
second half of the cycle, the luteal phase, is dominated by a cyst on the ovary that forms that will help support a pregnancy if there is a fertilized egg called the corpus luteum. So the corpus luteum produces more progesterone, and that's the second half of the cycle. The corpus luteum lives 14 days. So we know that from ovulation to menstruation will be 14 days. And
mm,
that makes it easier to kind of track cycles, but you're always doing it retrospectively. But we know that if someone has a 21-day cycle, their follicular phase is shorter because
mm.
they'll ovulate at around 1 week and then they have that 2 week luteal phase. So the 2 week luteal phase is pretty much locked in plus or minus a day or
And
two here and
cysts
there.
are normal. It's just a matter of whether or not they burst.
Well, actually, a cyst is how we ovulate. So every woman gets cysts every month if they are not suppressing their ovaries. They're natural, they're called follicles. And every single month, one of those cysts becomes dominant. It has an egg in it, and that cyst ruptures, it breaks. every month if you are not suppressing your ovaries. So when I have people that come in and say, oh my God, I get cysts every month, I'm like, that's a great sign of fertility. But some people can be more sensitive to the follicular fluid. So the fluid is encapsulated, and when the cyst ruptures or bursts, that fluid gets released into the abdomen, and it's a foreign substance. So our abdomen fights against it and we get inflammation and you can get pain. So that actually even has a name, it's a German name, Mittelschmerz. And we know that some people feel their ovulation. The other huge myth that makes me crazy that's still being taught in health classes, I can't even believe it, is that the ovaries alternate which side ovulates. The left ovary has no idea what the right ovary is doing. It's a predominant follicle that just has more hormone receptors for follicular stimulating hormone or follicle stimulating hormone. So you can ovulate 5 times on the left and then once on the right. It doesn't take turns, just like your kidneys don't take turns excreting urine. They're both working all the time. So sometimes people will tell me, I do ovulate on both sides. I'm like, great, but it's not going to alternate one way or the other.
Wow, my mind is already blown, and I am going to put out there, just as you had said that you weren't, when you were younger, sure that you wanted to talk about or experience all of the things that your body was going to experience. I will say, as much as I have learned and study of the human body, the reproductive system and health is definitely out of my scope. I don't work with prenatal, any kind of prenatal massage. I don't. So I'm already like, first of all, I had no idea. I was taught also that they alternated. So this was the first time that I hadn't heard of this. And there's some other things that we have talked about in the past that I really want to make sure to hit on with HRT, but that I hadn't known until I talked to you, which is why I'm so grateful that you're coming on and giving this information, because a lot of things that any of us train in, regardless of whether you're a voice teacher, whether you're in biomechanics, whether you're in medicine, when we're studying in a school system, as wonderful as those systems and information can be, it is often outdated information. It's usually at least 14 years old, which is very old when you're considering the human body. Like, that information from 14 years ago is, I mean, a
So outdated.
century ago when it has to do with the human body. So, wow. Okay. So I didn't know any of that. Okay. So, and just
So that's
really
kind of basic menstruation.
and
So
interesting to
that's
hear the hormones and how their impact. I mean, I knew about an estrogen being kind of estrogen dominant in the beginning and then progesterone dominant at the kind of closer to the end of the phase, but I didn't understand how that influenced around the mucosa.
Yeah, and so that's kind of the cool biofeedback loop that happens once if the egg is not fertilized, then the ovaries, the corpus luteum no longer produces as much progesterone. Progesterone levels drop, and your brain sends a signal that says, okay, we can shed the lining. It's time to start over again. And it starts all over again. But that's one of the reasons, and I have a feeling we'll get to this with the perimenopausal period, that it gets so irregular because perimenopause, or the time leading up to menopause, similar to puberty, is a decade-long process. Girls don't go from a tiny little breast bud to a full-grown woman in a year. It's like a 10 to 15-year process where our entire body wakes up to estrogen. It just, all of our systems change. There are growth spurts, there are changes in hair patterns, there are changes in our teeth, there are changes in nails, there are changes in temperature regulation, because temperature regulation is needed for fertility. And so all of those things change. And then you have 15, 20, 25 years of pretty regular-ish cycles, depending on life events and who you're living with. And women tend to cycle together when they're in clumps and not changing their cycles with medications. But then the ovaries start running out of eggs. And so you have this tapering of estrogen and progesterone, which is produced by the follicles. And so one month the brain is going to send hormone to the ovaries and say, okay, it's time to produce follicles. And where you may have had 20 follicles before, you may now just have three. Well, that's a
Mm.
lot less estrogen and progesterone in your body. So estrogen thickens our lining, less estrogen, less thickness. So we might get a super light period, but then our brain responds to that and says, oh my gosh, we only had three follicles. We need 20 follicles. So the next month it sends huge amounts of follicle stimulating hormone. We
Mm.
end up with a big surge in estrogen because now there are enough cohort of primordial eggs to create 15 or 20 or 25 because there's so much follicle stimulating hormone. And our estrogen level gets really high, our lining gets really thick. And then we're sitting at work and we have to tie a black sweatshirt around our waist because it's like a massacre occurred. But then the brain responds with the next month, oh, we produced too much. So it sends less follicle stimulating. So you get this sort of seesawing that happens. But the problem is that we want answers. Just like when someone comes to me and they're pregnant and they're like, okay, can we see a heartbeat? Like, not until it develops.
Mm.
Like, there are certain things I can't make it go faster. And that's part of the beauty. I can't tell you exactly when your baby's going to come. I can't tell you so many things. There's still so much beautiful mystery in it. But the problem is that perimenopause, or the time leading up to menopause, is like an 8-year-old in the backseat of the car on a long car trip. Are we there yet? Are we there yet? Are we there yet? And we want a signal. We want like a mileage sign. And there really isn't one. So this is one of these places where the GYN community is very divided. And you may get a ton of people saying, but I want my hormones measured and I got mine measured and I got my hormones tailored to suit me. But when we're measuring, because of this sort of seesawing, I can measure somebody's hormones and tell you where they are on that day, but it's not going to predict the future. It's not going to tell me
Mhm.
how much longer until they get there. But this is where physicians need to be better about not just ordering a test, but explaining what's happening. And then also explaining that we can treat the symptoms with medication. So it's not you have perimenopause, your hormone levels are normal on lab work. Piss off, I'm not going to do anything for you because you're normal. No, like we can treat, first of all, we can meet people where they are. We can say, oh my gosh, this sounds miserable. What are your top three symptoms that are making you crazy? Is it brain fog? Is it the temperature swings? Is it vaginal dryness? Is it you are singing on Broadway or as part of a cabaret or on a touring show and you missed two periods and your cycle is all out of whack and you feel like you're in perimenopause and you're having hot flashes and you can't focus, you have brain fog and your voice is changing. There are so many things like, okay, we can help to regulate that by either giving back hormone or treating the local area with a little bit of estrogen, depending on what the issue is. So
Mhm.
tailoring the treatment to the individual is really the key to helping people successfully navigate this perimenopausal period of time,
Mhm.
which I still haven't answered your IVF question.
That's
Um,
okay. I want to get to it. I totally, and so we're gonna like put a pin in it and come back to it because you mentioned that. So let's go through the life cycle because you mentioned that perimenopause, like puberty, is roughly about a decade. But I also don't know that we all recognize that the transition of puberty is a decade.
yeah.
So
I mean,
maybe we'll
think
start
about,
there and go through the span, and then we'll come back to
sure.
my IVF question.
Absolutely. So I give talks a lot about menopause and perimenopause. And there are a lot of phenomenal OB-GYNs that are speaking to this right now. But a lot of them are also selling their stuff. They're selling their diet plans. They're selling their supplements. They're selling all of their things. I'm really trying not to sell anything other than let me give you really good information.
Mhm.
Um, so if we think about puberty as this transition from child to adult,
Mhm.
oftentimes we'll just say girl to woman, but if you don't identify in that way, totally fine. So it's really childhood to adulthood.
Mhm.
And if you think about what happens, and this is where people come in that are perimenopausal and they say, well, I haven't changed anything, but I can't lose weight and I can't focus and my skin is changing and my voice is changing. Well, when I was 10, I didn't do anything differently, but my body grew boobs, my body grew hair, my voice changed, my skin changed, and I started to menstruate. I didn't have to
Mhm.
do anything. My body does it. So our brains think that we can control all of these mechanisms within our body, but we really can't. So the transition into puberty is this really amazing thing where, I mean, I went to a lecture about 10 years ago on breast cancer, and the physician pointed out, and it was remarkable that no one had ever said it out loud to me, that the breasts are the only organ in the human body that develop outside of the uterus. They develop in the world. Like every other organ is fully developed inside the uterus, but it just grows. There is zero breast tissue. I mean, sometimes there are little breast buds in babies when they're born because they've responded to their mother's estrogen, but those go away. And then there's zero breast tissue until puberty. And it usually starts asymmetrically. It usually starts with a tender bump underneath a nipple on one side or the other. But I mean, there are phases in puberty, including a full remodel of our brain for both people assigned male and female at birth. I mean, I used to joke with my kids. My ex-husband and I used to say, you have Swiss cheese brains until you're 25, which is why car rental companies know that. They won't let you rent a car until your brain is fully formed. So, and that's not a me thing, it's not a judgment thing, it's a science thing.
Mhm.
So, this transition into puberty all of a sudden is bathing our bodies in estrogen, progesterone, testosterone, and all these new hormones that we've never actually produced or had to deal with before. And then we are in our reproductive phase, which is marked by cyclicity. Every month it's a cycle, unless we suppress those hormones with contraception. But stress is also going to impact it. So
Mhm.
stress, changes, moving. I mean, the 20s are horrible for menstrual irregularity because, and part of puberty also is typified by this menstrual irregularity. I liken it to you're making a road from your brain to your ovaries. When you have two new towns and you're building a road, the road initially is just two dirt tracks from the transport back and forth. But then the road becomes a little bit more traveled. And so people throw gravel down, and then it becomes a paved road. And then it becomes a 5-lane freeway, like in California. And then as the road gets older, you get potholes in the road. And then the road starts to break down a little bit. And then it's not as smooth anymore. And then you might have to make some detours or you might have to make some bridges. But the road kind of disappears at the end because that communication stops. You don't have eggs there anymore. It's a natural process. But just like building a road, it takes time to do it. So puberty is the road from childhood to adulthood.
Mm. I love that analogy. That's incredible. And then you discuss through the menstrual cycle, and if you want to mention anything else through perimenopause, I know before we had discussed, and when I met with you months ago, that I know that I'm perimenopausal, though no testing has ever told me that. I just know. I know my voice well. I know the changes that are occurring in my voice. I know for me, a big one has been vertigo. And it was interesting because when I asked an OB-GYN that I was seeing, could the vertigo be part of perimenopause? I was told no. And I was like, really? But I feel like if there's cognitive, if I can get brain fog, if I can get cognitive, you know, decrease or awareness, I mean, wouldn't it make sense that it could impact something like my vestibular system?
And it's interesting. I think as we learn more and more, there's not been a lot of research done. So in defense of OB-GYNs everywhere, we're taught almost nothing about menopause. One of the things that I've learned by listening to my patients over years is that all bets are off. Like if you're going through this transition, sure, why not? It could be. So let's look at it. is sort of my approach to any of the
Mhm.
symptoms. A lot of times, again, going back to the sort of puberty and puberty in reverse, I was never a big migraine-y person, except for when I was going through puberty. When I was 16, 17, 18 years old, around the time of my period, I would get horrendous vomiting, visual disturbances, visual aura migraines with my
Mhm.
periods, not every month. But then fast forward, I'm now 44 and I'm getting these intermittent migraines right around the time, potentially of my period, but I had an IUD in place, so I wasn't bleeding. So I wasn't paying
Mhm.
attention to my cycles because the IUD kept my lining thin and I wasn't bleeding. So all of a sudden, I'm having these cyclic migraines. I'm like, I haven't had one of these since, oh my gosh, this could be perimenopause. But there are so many other confounding variables that happen to us in our 40s and 50s that we can blow off. Things
Mhm.
like, well, around the time when I was probably going through the worst of my menopausal symptoms, my mom was ill and was dying. My youngest daughter was graduating from college and I was going to be an empty nester. I had given notice at my old job and I was transitioning into a new job. And then for those of us who are in our 40s and 50s now, and we're in 2020, throw COVID into that and
Mhm.
long COVID symptoms. It's impossible to try and parse out what could be COVID, what could be flu that winter, what could be perimenopause, what could be stress from family stuff, what could be all of the transitions at work. So just like our 20s, I always say the 20s are the decade of exploitation. We get worked to the bone and exploited for nothing because we are so hungry for experience. 40s and 50s are the same sort of intense pressure of we are now really kind of at the peak of our game and we're getting promoted or
Mhm.
we're taking our skill set and we're bumping it up to the next level. But that comes with stressors and pressures. So it was not uncommon. At that point, I was chairman of my department. I would walk in to run a meeting, and going from a warm day outside to cold air conditioned room, I would flush and I would drip. I literally was like dripping in meetings and hoping nobody noticed the trickle of sweat going down my back. And, it's embarrassing, but at the same time, I'm not going to stop the meeting and say, excuse me, while I go take a quick cool shower and shower off. It can be very distracting, but it's hard to accept the changes, to acknowledge the changes, to see them for what they are. And then the number of people that come into the office and say, I think I have undiagnosed ADHD.
Mhm.
And it's a combination of multitasking, and your brain does change. There was a great study that came out this year. It's a beautiful study with MRIs that were done of women going through perimenopause. And it shows that there's a remodeling, just like we talked about when you have Swiss cheese brain in puberty, you have a shrinkage of gray matter during the perimenopausal period, and they age match the controls with men at the same age. So they know it's not just from aging, they know it's the hormonal shift. And then there's conservation, and some of it comes back.
Mhm.
So, we are this amazing species, one of very few species where after we reproduce, the females stay around for generations. Killer whales are the other one that always comes to mind because they're a very matriarchal society where the grandmother orcas have the knowledge for the next generation. So they help raise the next generation. Grandmothers are important to our culture and our society. So the gray matter stabilizes in our brain and we move forward. So it's these incredible parallels between puberty and menopause that I always like to remind people. But part of that does involve this remodeling in our brains, which when we are high functioning individuals, we don't always give ourselves the grace to just say, I don't remember that. There. failure sometimes just is not an option. We have to figure out how to navigate it, but also being kind to ourselves through that process,
Mm-hmm.
honoring the process as a really exciting renaissance. I think our culture and our society has a tendency not to revere the aged. We
Mm-hmm.
have a tendency to vilify aging, hence all of the lasers, injections, look young for forever, change all of our things. We're fighting aging, where I think that if we revered aging, we may have a different perspective as to this menopausal transition and embrace it in a slightly different way. So when people come in and they're talking about the frustration with perimenopause, there is an amazing peace and grace that comes at the end of the transition. So the sticky wickets in our lives are the places of transition. And if you think where the ocean meets the shore, that's a place of transition from water to land. And sometimes the waves lap gently against the shoreline. Sometimes you get those big rollers that surfers love. And sometimes it's like the cliffs of flippin' Dover. Like
Yeah.
you are crashing against the rocks, but that's a transition. And
Mm-hmm.
so, if we honor that transition and know that we're coming out on the other end of it without the cyclicity of menstruation, with the consistency that we had in childhood
Mm-hmm.
of not being premenstrual and not waiting for our periods and not having to deal with bleeding and not having to deal with the change in estrogen and progesterone, it's a renaissance, not a death. So if we
Mm-hmm.
can flip the script and empower people to transition through that perimenopausal period, not white knuckling, but open arms embracing, and then dealing with the symptoms that are not good for their quality of life, I think that we would all transition through it more easily and more healthfully. So
Mm-hmm.
that's where, exercise, nutrition, diet, quitting smoking, marijuana is not great for us during this transition because our brain's remodeling and we need to, work through that. Granted, if you have a tremendous amount of anxiety, edibles over smoking is probably better, but it is a brain altering chemical. So figuring out what cocktail will help you with sleep, with sweats, with hot flushes, with insomnia, with all of the things that happen to us in our body, but giving ourselves the grace to know that it is a transition and there will be easier years and harder years, but at the end of it, we will come out intact and better.
Mm-hmm. Mm. I encourage all of the listeners, if you haven't already, listen to this episode along with Joanne Bozeman, because Joanne mentions that throughout the book of Singing Through Change, they were able to notice that as someone came to be postmenopausal, some of the vocal irregularities that happened through perimenopause started to regulate for a lot of those people. And I think Erica or Dr. Kesselman just very much beautifully described why that could be and the changes that are actually occurring in the brain. And that though there's shrinkage, it can come back a bit too. So that was incredible. And just having that information to back up and go along with the voice information in Joanne Bozeman's episode. So please combine these together because this is incredible
I mean,
information.
think about Aretha Franklin's voice when she started and when
Mm-hmm.
she ended. I mean, they both have so much richness and power, but they're different. They're
Mm-hmm.
definitely different. But that's what makes the divas so incredible. Looking at the transition keeps it interesting. Like, as a postmenopausal woman, like, I would want to be a torch singer. Like, that's sexy AF.
It is. This is so timing is amazing too, because yesterday for the Academy, Dr. Aaron Johnson came in and gave a lecture on the aging voice. And I do have a podcast episode way back in 2019 with him talking to me on the podcast about the aging voice. So even incorporating that into this episode to be like, just listen to the three together because it's incredible information. Um, so okay, so now coming in with that kind of all of that behind and underneath and as the foundation of the life hormonal cycle. Then coming in and kind of starting to play with that cycle. So we'll kind of start with IVF and then move into like hormone replacement and all of that.
Mhm. So with IVF, depending on there are different levels of IVF. Sometimes the reproductive endocrinologist will just give an individual who is just having a hard time ovulating a medication to help with ovulation, and then they'll give an injection to stimulate ovulation. And then they'll introduce sperm at a specific time. They'll usually wash the sperm and then insert the sperm. Sometimes, if you're doing an egg retrieval, they will stop your cycle completely and then start the cycle, modulate the cycle, watch with ultrasounds to make sure that the follicles are, there are enough follicles. Then they give the injection and then they do an egg retrieval.
Mhm.
But then, if they're cycling you for an IVF cycle, they basically are modulating your hormones for you. So they know exactly when they can put that egg in or that embryo in and have it succeed. So your hormones are being modulated by the reproductive endocrinologist in order to time things to mimic the actual natural cycle. After there is, after the embryo is placed, if you're doing full blown IVF, you are placed on progesterone usually because you don't have that corpus luteum cyst. You haven't ovulated. They need to simulate the progesterone that would be created by the corpus luteum cyst. And so you are given progesterone, sometimes vaginally, sometimes orally. I'm not sure if they're still doing the injections, but they used to use injected progesterone and oil. Um, and again, not my area of expertise at all. So if anybody is going through this and I am getting it wrong, this is my disclaimer. I'm sorry. It has been a while since I've done it, and it's just such a hyper specialized area. But then once the placenta takes over, if hopefully, fingers crossed, embryo does well, you get implantation, you can stop the progesterone usually around week 12, week 13. Once you know that there's an embryo, once you know the placenta is forming, then it's pretty much on to normal pregnancy.
Hmm. Great. I was so curious about this because I obviously know a lot of people who have done and are doing IVF. I did not have to do that. But I notice with my clients who are going through IVF or have gone through that when and we know in singing, some of us, not all of us, are a little bit more susceptible to some inflammation right before our menstrual cycle, right before our menses. And we might experience more inflammation around the mucosa of our at the laryngeal level. So we experience some inflammation. It just feels thick around the vocal cords. Well, what I've noticed with several of my clients who do IVF is very similar thing, where they're experiencing inflammation at the laryngeal level and they're having a hard time with the amount of voice use that they are asked to do because these are elite vocal athletes who are performing and using their voice a lot and aren't aware that this could be a component of IVF and that they're just it's not a problem. It's just something to monitor and to kind of get ahead of that. It's possible that the IVF, just like our menses, can impact the laryngeal level of amount of inflammation.
Oh, absolutely. I mean, during that luteal phase, progesterone is a wicked hormone. I mean, it's amazing and it's magical, but anybody who has had a first trimester pregnancy knows that they're peeing all the time. Well, you're peeing all the time because, I mean, it's not because of the pressure of your uterus. Your uterus is still teeny tiny. So it's not that, it's progesterone that makes you pee like crazy. So it definitely affects our bodies. And when we think about the PMS in that last 2 weeks of our cycle that's building, that's progesterone dominant. So absolutely, if their hormones are being modulated, just because they're not being created by our own ovaries doesn't mean that they're not still having the end organ effect. So hormones, we always talk about like a key and a lock. But you can think about a 3D printer creating a key that's synthetic, it's going to still fit the lock. So any of those target organs, it could potentially affect.
Hmm. Yeah, I think that, and that's the whole reason I wanted to bring this up with you. And I'm, thank you for going into that. And if someone is a specialist in that, then please let us know.
Reach out, help
But
educate us.
yeah, help educate us. But I just wanted to bring it up because one, I love the information that you provide. And two, just seeing this in my clinic and trying to help my clients understand that, yes, absolutely, that could be impactful. And what are things that we could do? Both, it's also informing our speech therapists and our voice teachers and our doctors, our medical professionals, that if you're working with a professional vocal athlete, and we're working with anything to do with hormones, there can be an impact on the voice. And just making sure that, not to scare anybody, but just to know that that is a possibility, and that to assist with that, what do we do to help with inflammation? What do we do? And then this is challenging because of a lot of our NSAIDs or anything like that we don't take for at the professional level, um, because of a uptick potential of hemorrhage. But what other things can we do to help with that kind of inflammation? What can we do to just know that these are things that we're going to monitor? So I think it's just an important thing to bring up, that anytime we're starting to help with any kind of modulation of hormones, even our own natural hormone cycle impacts. Some people feel it less, some people recognize and feel it more. So just knowing that that is a possibility.
Also, at the risk of sounding like getting all out there and woo-woo-y, if you think about, the Ayurvedic chain, and you think about the throat chakra and the root chakra being so incredibly intertwined. I mean, all of the energies are, but throat and root are really, really tightly wound. So if you're doing all kinds of stuff in the area of your root chakra, it would be naive to think in a science that has been around for millennia that connects the root to the throat, that there aren't going to be channels that are going to cause some of that interconnectedness. So thinking about body, mind, and spirit, also thinking about the breath. In
Mhm.
early pregnancy, your diaphragm changes, your rib cage changes, how you breathe changes. So
Mhm.
all of those things are going to affect how you're producing your sound, from the way you feel about your pelvis and in your pelvis. If you're feeling crampier, if your ovaries have been hyperstimulated, if you have too many follicles, that can cause tremendous amounts of pain, pressure, bloating. What is that bloating there going to do to the rest of your body? So, yeah, you can get inflammation from the process. And then how our bodies respond to that is going to be profound.
Mhm.
So honoring that root throat dyad, I think, is also something to always remember.
Mhm.
Success leaves clues. This is a science that has withstood the test of time. And just because it's not in Western medicine roots, it doesn't invalidate it. And so there's a lot to be learned, I think, from that branch of healing as well.
Yeah, thank you for bringing that up, especially as a medical practitioner, and the fact that you are open to practices that have been around for
Oh,
centuries
yeah.
is, yeah, I thank you for bringing that in.
So
Um,
acupuncture and temperature regulation is
mm,
something in the, Ayurvedic world and in the Chinese medical texts, plunging your feet in cold water to help to change your rhythms with regard to perimenopause and menopause. It's not going to hurt your body to do that. So are there things that we can learn and alternative providers that we can go to? Absolutely.
mhm. Yeah, in massage in New York, we have to study shiatsu. We study Eastern and Western.
I
And so we
love that.
learn all of the Eastern, the five element theory. And I I did a track where you have to choose at one point which track you're going on, and I chose both. So I
Ah,
would come to school extra in order to be able to continue on both tracks till the end because I really wanted to, not that I incorporate it with everyone, but I wanted to know more of the theory and to know pulse analysis and tongue diagnosis and just to know it, to understand that when we look at different Eastern medicine modalities, that these are very old modalities that have been around for a long time. And the more I started to learn five element theory, the more brilliant I believe it is. And the fact that these are things that were known 1,000 years ago, even more, even longer, and that we've lost some of that. I mean, the fact that I read through it and I'm like, yes, yes, wow, this ticks. Wow, this is amazing. This totally connects. It's
yeah.
unbelievable. So
Sometimes it's the missing link in our knowledge. It's been there all along.
yeah, yeah, it's incredible. I would love to talk about HRT, hormone replacement therapy, human replacement therapy. No, no, hormone replacement therapy. And because I was blown away when we chatted several months ago, and I did not know that. I didn't know anything about HRT other than once you get to a certain age, you go on HRT. Other than knowing that or hearing about bioidentical hormones, which I'm going to let you kind of get into if you
Yeah.
want. But what I really learned that I hadn't ever known before was it's like a birth control in a sense.
Well, yes and no. So, when you talk about birth control, it is estrogen and progesterone.
Yeah.
So, if someone is taking a hormonal contraceptive pill or patch or using the vaginal ring, what they're doing is they're taking estrogen and progesterone, which puts your body into, like, it's February now, it was just Groundhog's Day. If you've ever seen the movie with Bill Murray or the show Groundhog Day, it's the same day that's lived over. So if you are taking a combined hormonal contraceptive, estrogen and progesterone, or even just a progesterone only pill, what it does is it puts your ovaries into hibernation, essentially. It makes it Groundhog Day every day for your brain. Your brain is being exposed to the exact same amount of estrogen and progesterone. So it never triggers that mechanism to start follicles forming. So every day is a Tuesday in February until you go through your placebo if you are not doing continuous dose. And then you do what we call a withdrawal bleed. We call it a period, but it's not a period because it's not the cyclic changes that you have that results in menstruation. It's basically a withdrawal bleed. You've had hormone there for 21 or 24 days, and then you don't. The placebo pills generally are, sometimes they have a little iron in them, sometimes they're just sugar pills. And for 4 or 7 days, you have no hormone, your body sheds, and then you start all over again. So
Does that impact? So if you've been taking contraception, so I was put on it at a fairly young age because I had cysts that would not burst. And
Mhm.
or so I was told. I mean, I had an appendectomy because of a cyst that wouldn't, it was not appendicitis, it was a cyst that just wouldn't burst. So does that impact the amount of it? Would that extend potentially how long you would go before you would go into menopause and then postmenopause because it would extend the release of an egg? Or how does,
No, it doesn't.
yeah, okay.
They do degrade over time. So it's not that
Mm,
you're putting them in suspended animation.
hmm.
So it's not exactly like Sleeping Beauty, like you don't wake up with everything as it was. But time moves on and you will have X amount of reproductive time. The other question that I get actually a lot is, if you start menstruation earlier, does it mean that you'll go through menopause earlier? And there really isn't a huge relationship to that. The only thing that can actually shorten the period of time from menstruation to menopause, or a year after your final menstrual period, is smoking actually shortens it.
Mm.
So I think I'm not 100% sure on the statistic, but I think for every pack year, meaning that you smoke a pack a day for an entire year, for every pack year, menopause comes 2 months closer, 1 or 2 months closer, or shorter. And that actually has a big effect on bone health. The earlier you are when you finish your menstrual time,
Mm-hmm.
the higher probability there is that you will have an osteoporotic fracture. So one of the things that is a risk for stopping menstruation by taking estrogen and progesterone, your body still has estrogen and progesterone.
Mm-hmm.
Estrogen helps with laying down of bone. So it helps you to reach your optimal bone density, but we reach our maximal bone density in our mid 20s. So anybody who's listening who isn't getting periods because they're a little too lean, because they want to look like some of the people that have gotten really, really lean. So if they're not getting periods, they don't have enough estrogen. If they don't have enough estrogen, they're not laying down maximal bone. So you
Mm-hmm.
have really until your mid to late 20s to maximize your bone density. And then it's a slow decline until the time around menopause. And then it speeds up. For about 3 to 5 years, we lose more bone, and then it tapers back down to a normal bone loss. So estrogen and progesterone are really important, estrogen especially for this laying down of bone that we need. But you'll get that. So if someone isn't getting a period because they are too lean because of sports, or dancers, or individuals that are athletes that just need to stay lean for their sport, or their profession, I actually recommend putting them on a combined hormonal contraceptive, so they have the estrogen circulating through their bodies. And birth control pills have never been shown, the pills, the patches, or the rings, shown to cause weight gain. So it won't wreck that mojo. And it actually can stabilize your hormonal process because you're getting the same amount of estrogen and progesterone every single day. So
Mm.
that's a little bit different than replacing or adding back. So now there's kind of a shift in the vernacular. I feel like every 15 to 20 years, we change our vocabulary around different things to try and make it more PC or more welcoming or more. So we don't really call it hormone replacement therapy. We call it menopausal hormonal therapy, or MHT,
Yeah.
because we're not really, by replacing, it makes it sound like it's something that should be there that's missing. But the natural process, when people tell me I want to go through it naturally, I'm like, great, then let your body do it. That's the most natural way. But my symptoms are terrible. I'm like, okay, well, then we can start using our sciencey brains to help fix some of the symptoms that you're having. So when we give menopausal hormonal therapy, what we're doing is we're treating the depletion or the withdrawal. The symptoms that we get are because these cells that have known estrogen and progesterone for the last 30 years are now withdrawing from it. So that withdrawal causes the hot flushes, the night sweats, the brain fog, the temperature regulation issues, the changes in mucosa, the vaginal dryness, probably the changes in the oropharyngeal mucosa definitely is a part of that. And so adding back a little bit of hormone, whether it's estrogen or progesterone, can definitely help with that. Testosterone is being heavily researched in women right now. I am definitely not a fan of giving women testosterone for well-being, for longevity, for energy, and for fatigue. It actually scientifically has not been shown to change that. And there's a lot of data coming out now to add back a little bit for libido. So if sex drive is declining, the issue is that testosterone is a hormone that can be both created and broken down inside a cell. which means that we can't measure it outside of the cell in the blood.
Mm-mm.
So there are women that have amazing libidos and really low testosterone levels. It's discordant. So our
Mm.
testosterone levels really peak in our 20s, and then they slowly decline over time until menopause. And then after menopause, ironically, they start to creep up a little bit, which is why we get that one black hair on our chin as we get older. And why potentially why our voices deepen a little bit. It's that uptick in testosterone. Now that I think about it, if you think a lot of the changes that happen in women, the losing our hair, more male pattern baldness in the elderly. Why? Because testosterone levels are ticking up. So you get the same kind of symptoms that you would if you were taking exogenous or testosterone from outside of our bodies.
Mm.
So it it fills the gap to ease the transition is how I like to think about menopausal hormonal therapy.
Mm-hmm. Thank you for clarifying that too, because I have never heard of MHT, menopausal hormonal therapy. And I think, I mean, these are things that I just don't hear about and don't talk about. So really incredible to hear
Welcome
this.
to my world.
Yes,
Willkommen.
I
Bienvenue.
know.
Welcome.
Welcome. I would love to just hear the most common questions that you are asked that you feel like you have to kind of answer over and over and over again. And
Uh,
just allow the listeners to know the answers to some of your most common questions, or even like the most um, shocking of answers, or maybe the newest of information, anything around that kind of feels comfortable or exciting for you to talk about. I would love to hear.
Thank you. I feel like we've really addressed some of my really big talking points. The big concern I have now, and the soapbox that I will probably die on, is supplements are not always safe. Bioidentical is actually a total misnomer. Our bodies use at least in the tens of different types of cholesterol to create estrogen and progesterone. We've broken it down to the top four that we can really see. Estrone, estradiol, and estrione are the ones that are available in the United States. So having hormones compounded by a pharmacy or by an individual or by a company to be tailored to your body, insurance doesn't cover it. A lot of physicians don't do it. A lot of chiropractors, naturopaths have jumped in and are doing it, but a lot of it is unregulated. So to spend thousands of dollars to get your hormones measured, to know where you are on that day, to have pellets that are then created specifically for you that are injected into your gluteus muscle and you can't get out again, can actually cause negative things in your body. So it's a buyer beware. It's frustrating for me because a lot of women go to their OB-GYNs first and don't get a sufficient answer and don't feel heard. So
Mhm.
they move on to providers who will listen to them. And it costs a lot of money and it's not always regulated. So I'm not saying that this is a bad thing. For a lot of women, it is life saving. And I wish that we could integrate it into a regulated world of safety.
Mhm.
There are a lot of supplements that can claim to have uh, natural estrogen and progesterone in them. Um, all of it essentially comes out of the same factory. So most of our synthetic estrogens do come from plant base, either from soy or yams, but they have to be broken down in the labs because I don't know about you, but I have actually never photosynthesized. I think Alphabet may be the only person who potentially could, but we don't have chlorophyll, so we can't photosynthesize. So can we break down the plant-based estrogens and progesterones? Plant doesn't always mean safe. There are
Mm-hmm.
a lot of chemotherapeutic drugs that are meant to tear down our cells that are plant-based. So they're not always safe. But to have a plus or minus $60 billion industry, which is our supplement industry, that can claim anything because they are completely unregulated. And the only checks and balances is a 1 million with an M dollar budget that comes from the Food and Drug Administration. So you have a $60 billion industry. It's like Cheerios when they came out and said they're heart healthy. Well, yeah, if
Mm-hmm.
the study compares Cheerios with a bacon, egg, and cheese, your heart's going to be healthier with Cheerios. But is it really? That's always the question. So, what I always say is if you're taking a supplement and it says that it's for ovarian support, it's because they can't tell you exactly what it's doing to the ovary. If it's for brain health, brain support, I want to support and help my brain. I want brain health. I want bone health. But what it's telling you is that the ingredients may not be what they are. I always think about that quote from Princess Bride. I do not think that means what you think it means.
Yep.
It's almost like if you read fiction where there are fairies. If you ask the fairy population for something, they'll give it to you, but be careful what you ask for. When you're making the wish from the genie, be careful because it may not be exactly what you thought it was going to be. And if you are getting something that is over the counter, but it still reacts to the estrogen receptor, if it's a key that fits that lock, that is working on your estrogen receptors in a completely unregulated way. If you garden, you may know that your tomato is juicy and ripe and amazing one year. You can use the same seeds, the same plot, the same fertilizer, and the next year it may be really not potent. So, how are they measured? How are they regulated? What are you actually getting? There was a great study done in New York actually looking at the spectrophotometry of different supplements. And I think it was a huge number, like 60% had zero of the ingredients that were listed on the label actually in the medication. It doesn't have to be there if it's unregulated. So, placebo effect is 40%. So, what I
Mm-hmm.
will tell my patients that are hell bent on doing any of these pills or supplements, try it. But why don't we make an appointment for 4 months from now? And if you've not had a period and you start having bleeding and you're on any of these kinds of supplements, call your doctor because it can increase your risk for uterine cancer. So, unopposed estrogen leads to malignancy. So, if you are getting 10 times the amount of estrogen that you should be getting based on a single blood test or based on a supplement that's unregulated, it can cause harm. It
Mm-hmm.
can cause liver damage, liver failure, depending on what supplement you're taking. And the supplement companies also don't have to report it. They don't have to do the studies. They're going to give you the studies that they have, which may or may not have been done by physicians. There's very little peer review in those articles. So, the people that do research, meaning that they do a Google search or they are part of a chat group, I honor the fact that they're looking into it. I think that's great that you're trying to inform yourself, but try and form a dyad with a medical professional who will show you the literature. So
Mm-hmm.
when individuals come in and they have their laundry list of what I have to prescribe for them, it feels a little bit disrespectful in some
Mm-hmm.
ways. Coming in to see your doctor isn't like a Chinese menu where you choose from column A, you choose from column B, and then you get what you want in your plastic baggie. It takes me an hour to explain fully all of my knowledge around a subject. It takes me a minute to write a prescription. It's way faster to
Mm-hmm.
write the prescription. So partnering, learning, I won't debate with my patients. I will basically say, I appreciate you are where you are. If that's the research that you want to do, that's fine. My background is I did 4 years of college, 4 years of medical school, 4 years of residency, and I've been in practice for 25 years. If you're coming to me for my opinion, this is where it is. These are the journals that I use. Here are the resources that I have. I can only tell you my science. I can't tell you yours.
Mm,
So come back to see me if your way doesn't work and you want to try it my way, but there's no harm, no foul.
mm,
There's no hard feelings. I just need people to know that what they may be getting may not be what they think they're getting.
mm.
So that's my soapbox.
Wow. Yeah, that's incredible. I have so many things to go off of with that. Now,
We may have to do a part two, Christine.
I know, I'm like, wow, that just brought up about 8 questions in my brain, and I'm trying to organize what I want to ask. I want to come back with that information and then coming back to when you were describing coming through perimenopause and coming through symptoms and MHT helping with the symptoms of it. Are our bodies fully capable of coming through this transition without anything?
Absolutely. So
See,
there's a
that is something that I didn't, that I have never heard, that we have to have some kind of help through that transition. So that's
you
amazing to
no,
me.
25% of women, there was a great study called the SWAN study, the study of women across the nation, that looked at women going through the menopausal transition. And what they realized was that 25% of women will start having symptoms really early. So again, if you think about this 10-year period of time, 10 to 15 years for some people, I have patients that are in their early 40s that are having some symptoms. I started having some symptoms in my early 40s. The average age of the final menstrual period is 51.
Mhm.
So if we think about, okay, things can start about 10 years before. Well, that was also when I was doing half marathon training. So there were some times that I would have crazy hot flushes and night sweats. And I just thought it was after my longer runs and it was the breakdown of lactic acid. I could explain away any of my symptoms. But could it have been the beginning? Yeah, looking back, absolutely. But you can't put an old head on young shoulders. So, when we know better, we do better and we learn more. So, of these, so 25% of women will start with symptoms earlier. And then once they have their final menstrual period, they'll have symptoms for a short period of time after. 25% of women will start having their symptoms closer to their final menstrual period and then go on a little bit longer with their symptoms after. 25% of women have almost no symptoms. And then the lucky 25% that are the super flashers start early and go long. And they may be feeling symptoms into their 60s. And some women actually have periods into their late 50s. So, the average age is 51 of the final menstrual period, which means half of women are going before and half of women are going after. So, if you are not having symptoms, you do not have to take anything. We think about the people that they've studied that live on these hills, that live for forever in the Far East. I don't think they were taking hormonal replacement
Mm,
therapy and they're living into their hundreds.
mhm,
So it's not the fountain of youth. What it is a tool that we have that can either be synthesized in a lab or either fully synthesized or partially synthesized. The one I actually joke sometimes, and I try not to get really glib with this, but one of the medications that's been around the longest is Premarin. And if you break down Premarin, the first sound in each, it comes from pregnant mare urine. So if someone says, well, I only want natural hormones, I'm like, well, it doesn't get more natural than horse pee. And that's a really natural hormone. It's made from pregnant mare urine. And they found there was a lot of different estrogens that they combined together, and they used that as Premarin. A lot of people were really kind of put off by that. So that's how we started getting the semi-synthesized estrogen. And then some people wanted a more targeted or just synthesized estrogen. But there also is a whole class that we haven't even gotten into called SERMs, which are selective estrogen receptor modulators. And these are for if someone has breast cancer but they're having vaginal symptoms of dryness, they can take a targeted synthesized estrogen like medication that will target the estrogen receptors just down there.
wow.
amazing. Like people want cancer treatment that just treats the cell. We now have synthesized estrogen receptor modulators that can target the different parts of our bodies that are getting the menopausal symptoms. So my thought is we can do really cool sciencey things to help us with our symptoms.
Mhm. Wow. Okay. So I want to come back to supplements because I am a supplement taker, like my vitamin D3, K2. I don't want to go without it during this time of year.
That's a good one. That's actually, there are some supplements that I really, really like.
Yeah, so that's kind of what I wanted to go into are what are supplements that, and now understanding that in any supplementation, I take a D3K2 tincture, um, but I also just don't buy some random one off the shelf because you want to know as much as you can about where you're getting it from. But what supplements do you think are important to include?
So there are some things that are sort of in my toolbox that I really like. So at this time, when the other thing we haven't really talked about is the weight gain that goes along with the perimenopausal transition, that is a natural part of this transition. I think some of that shifting in our weight, and it might not be numbers on a scale. A lot of times it can just be, I call it a reallocation of resources where all of a sudden you get a little bit extra around your middle, which is never been there before. And that is visceral fat, which is a more dangerous fat than the inch that you can pinch, like hips and
Mm,
thigh fat. So hip to waist ratio is an important thing to look at. But a lot of people start into all of these diet fads around this time, and the yo-yo dieting isn't great. What I will usually recommend is instead of taking away from what you're putting into your body, adding a little bit of fiber. And a lot
mhm,
of the fibers now come in a powder form that you can just throw in your coffee. Um, and so adding a little bit of fiber with collagen and with
mhm,
protein, because the other thing is women just don't get enough protein, especially during this time. And if you're vegetarian, it's even harder. So adding back protein, adding back fiber, and adding in a little bit of collagen is great. It helps with hair changes, nail changes, skin changes. It adds the fiber, it adds the protein. So I'm a big fan of that.
mhm.
And it helps you feel full longer and faster. Protein helps you feel longer, fuller for a longer period of time. Um, Vitamin D and calcium are both imperative. So, as you're going through the transition, before the menopausal transition, your body needs about 1,000 milligrams of elemental calcium. So, best way to get it is from the foods that you eat. So I'll tell my patients to just keep a record of the amount of calcium you're getting in the foods that you're eating. Also remembering that your body can only really absorb 500 to 600 milligrams of calcium at a pop. So not taking a calcium supplement with a big glass of milk or with your yogurt in the morning, but eating a higher protein yogurt like a skyr or an Icelandic yogurt or a Greek yogurt is a great way to add protein, add dairy. So I have my patients keep track for a couple of days of how much calcium they're getting from the foods that they're eating, and then adding a calcium supplement at times when they're not eating calcium rich meals. Vitamin D, absolutely big fan. Because especially in mid-Atlantic, New England, any place north, we just don't get enough in the winter. And
Mhm.
if you are light eye, fair skin, light hair, you're wearing sunscreen, which is going to block some of that vitamin D absorption. So you need to make sure that you're getting enough vitamin D. Minimum requirement of vitamin D is, they say, 600 international units. I'm a big fan of 800 international units to 1,000. But having that is one of the things that I do recommend actually getting measured, especially if you're feeling more fatigued. So I challenge physicians when I talk to primary care physicians about menopause, have the ability to add things to your patient's regimen, hear what they're saying, but also if they're asking for lab work, you don't have to do estrogen progesterone. You do need to make sure they're not anemic. You do need to make sure that they're not vitamin D deficient. You do need to make sure that it's not their thyroid, which can also transition tremendously during this time and can cause a lot of the same symptoms as menopause. So, doing specific blood work, I am 100% in favor of. And then adding the supplements like calcium, vitamin D. If you're having a lot of leg cramps or getting muscle fatigue, magnesium also, we have a hard time getting from the foods that we eat. So, elemental magnesium also is really important. And although I'm not in favor of a lot of the over-the-counter supplements for hot flushes and night sweats, not a big fan of the over-the-counter estrogen replacements, but there is a cocktail that has some benefits for some of my patients of primrose oil, flaxseed oil, and a B complex. Taken together at night can sometimes provide relief. Again, placebo effect is 40%, but if it's working for you, then it's great. And it's not harmful. It's not going to trigger that estrogen lock.
Thank you. That is so helpful. And those are when I was training and running marathons, I absolutely had to supplement in potassium and magnesium. But I get blood work done quite often just to make sure that levels continue to stay normal and et cetera. So thank you so much for coming on today and having this conversation. I have learned a ton, and I definitely feel like I need to listen back to this episode multiple times to really, I want to take notes too, because today I just wanted to be present with you and really listen. And I jotted down the menopausal hormonal therapy. That's pretty much the only jot I took down, but
there is a great book that I absolutely love. I get no kickback from this at all. And I don't even know if this physician knows that I'm such a big fangirl of her. Dr. Jen Gunter, Gunter, wrote a book called The Menopause Manifesto that is smart and sassy. She also has a Substack called The Vagenda that is just so informative, and everything is really, really sciencey, which, as a science geek and as a scientist, I believe in tremendously. So that's a great reference that is fact-based, science-based. The read itself is interesting and informative, and written in a very lighthearted but serious way. So she's sassy. I think it was Margaret Mead said that there is no force quite the same as a menopausal woman with sass. And I truly am inspired by it. So I want to be a menopausal woman with sass.
Yes, me too. So what are some ways, if the listeners want to hear more about you, continue to watch you on your social media platforms, get in touch with you, what would be the best ways to do that?
So I do have a website, thegirlfriendsgyno.com, where I am starting to put together lots of blog posts. I've really only been at the social media thing since September, so it's still growing, but there are some longer form blogs about different types of birth control. I have a letter to new moms, just about going home with that baby and desperate to do it right and giving yourself the grace of imperfection. And then on Instagram, Facebook, and TikTok, you can find me at The Girlfriend's Gyno. So follow my link in bio at The Girlfriend's Gyno.
Yes, great. Amazing. Thank you, everybody, for hanging out with us and listening to this conversation. Dr. Kesselman, thank you so much for being here with me. And
thank you, Christine. This was a blast.
Thank you all for listening. If you enjoyed this podcast, tell your colleagues, students, and friends. Subscribe, rate, and please write a review. You can find us on Instagram or Facebook, and feel free to check out my website at www.thevisceralvoice.com for information on programs and upcoming events. I hope you join us next time for another wonderful conversation on The Visceral Voice.